Sometimes people then say to us, well, why do I have to talk to you? I thought I just needed to spit in a tube or get a blood sample. And it's that complexity of really looking at the patient's personal and family history, what genes or hereditary syndromes are even relevant, and also what are the advantages and disadvantages of knowing the information for a patient and their relatives, so that ideally after we talk with patients, they can truly make an informed choice about what do they want to know, and also what do they not want to know through genetic testing.
90% of patients that I contract with at the beginning of my appointment, if I say, what did your referring provider tell you about this appointment? What are you expecting? They will say, I have no idea. It's helpful for you to give some background and some explanation as to what's going to happen. You'll meet with a genetic counselor. They'll provide a risk assessment based on the information that you give them about your family history. They'll talk to you about whether or not genetic testing is indicated. And our job is to give a patient the tools to make a decision about whether or not they want to have genetic testing. Coming to see us doesn't mean that you have to have a genetic test. It may not even be offered once we get the full picture of your family history.
The other key take home point is that genetic testing is far more logistically easy and affordable than it's ever been before. So, when I first started practicing clinically in 2009, it was about $1,000 per gene cost to insurance. With 6 to 8 weeks, we'd test one syndrome, 6 to 8 weeks, we'd test the next syndrome. And there'd be a level
It's
of
awful.
fatigue that people would have and drop off before completing their risk assessment. More insurances are now covering the cost of testing, and many commercial genetics labs notify patients if their cost is over $100 or even offer discounted self pay rates of $249 or less.
I'm so curious, why are insurance companies covering this more? Is it cost effective?
Identifying a genetic syndrome in a family can also clarify who is and who is not at risk. Many of these conditions are inherited in a dominant manner, meaning even if a parent has a high risk hereditary cancer syndrome, their child has a 50% chance of also being affected with that syndrome and a 50% chance of not having it. So, before engaging on more intensive surveillance, for example, if a person pursues genetic testing to learn whether or not they even have that same level of risk, that can be more cost effective to not apply the extra medical care if someone doesn't need it. And that's the best news that I am ever able to deliver.
What do you feel like is the biggest benefit of knowing genetic profile early on?
So I think that the primary advantage of genetic testing is that it helps you better define your risk. It makes a difference as far as level of risk in knowing, well, do you have a first degree relative with colon cancer? And that means your risk is twofold higher than the general population. Or do you have Lynch syndrome? And that means your risk for colon cancer could be as high as 70%. So it gives you kind of a better sense of where you fall on the spectrum. And then that can also better inform what kind of screening and prevention options are most appropriate for you. So do we need to start colonoscopies at 40 or do we need to start them at 20? Do we do them every 5 years or do we do them every 1 to 2 years? And then no hereditary syndrome is associated with a single type of cancer. So it may also tell us that you have an increased risk for cancers that we don't see in your family history.
Hi, Peter.
I would say the thing that always strikes me about genetic counselors is also, the focus on the family. Genetic counselors do a great job of saying, okay, this is helpful for the person, but also this is going to help your kids or your brothers or sisters. And even people with end stage cancer feel very empowered by that. And it's really impressive to see if they can get their kids tested and say they're not at risk for this or that we can watch them for this. It's very empowering. And that's what I've always noticed is like the biggest difference between the way genetic counselors talk to a person or talk to the patient about it and what we're used to doing.
When we're speaking to people who have an active cancer diagnosis, it's often helpful to note who's part of their support team, who are the family members that are participating in their care. And while we do have to be mindful of HIPAA, we also recognize in genetic medicine that the information affects the family as a whole. We may talk directly with the patient and say, this information has significant implications for your relatives. Who were we allowed to share your information with? Can we use this for the purposes of their own care and make note of that and think about that? And it's not uncommon for us to receive amended reports from the commercial genetic testing laboratories years after someone was tested when more information's become available and the laboratory has reclassified a particular variant of uncertain significance.
Usually with more data, the vast majority of variants of uncertain significance that are reclassified to negative. Yeah, but certainly recontacting patients, particularly when an uncertain result gets reclassified to pathogenic, is really important so that we can tell them the implications that it has for them and their family. If you are a provider talking to a patient about their family history of cancer, it's worthwhile asking them if the affected family member underwent testing themselves. Because if that person did have genetic testing that was negative, we don't need to test the unaffected family member.
Different hereditary syndromes are caused by different genes and different specific familial variants from family to family. So we really need to ensure that the test ordered is going to detect the known familial variant responsible for the reason that family has their hereditary syndrome.
I see. I see. So nuanced. Interesting. What else do you wish that internists, um, subspecialists that are listening knew about genetic testing?
We also regularly address concerns about the potential for genetic discrimination. One fact that we talk about is the Genetic Information Non Discrimination Act, or GINA, which went into effect roughly 2008, which states that health insurers cannot drop someone from coverage, deny health insurance coverage, or base premiums on genetic testing results or family history. And that also includes employers with more than 15 employees cannot hire, fire, or base salary on genetic testing or family history information. And we also differentiate for people that the federal law GINA does not apply to private insurances like life insurance, long term care. I think from the initial referring provider perspective, having some basic information about the protections that exist can really encourage people to at least attend their appointment.
I would encourage referring providers to establish a relationship with the genetic counselors at your center or in your town or wherever you're going to refer to.
I'd also point to what are the
Trauma.
professional organizations that have established guidelines for referral that can be really helpful tools, which include not only the National Comprehensive Cancer Center Network, NCCN has guidelines for cancer genetic risk assessment that are freely available online, and then also the Collaborative Group of the Americas. And so even printing these and keeping a tool at the ready, in addition to your friendly local genetic counselor, can be ways to suss out who are the patients most in need of that appointment. The other consideration is that increasingly genetic counselors are available through the use of telemedicine. And so, even if patients live in more rural areas or it's more difficult for them to seek out genetic counseling, that can increasingly be done at times through a virtual visit. Alternatively, if to expand service access and delivery, primary care providers are ordering genetic testing. Genetic counselors are still available to help with interpretation of genetic test results, since, as we discussed, some of the variants can be very challenging to interpret. So, if there is a scenario where a patient has already had genetic testing, brings it into their primary care's office, and it's difficult to discuss, we're also happy to see people in the post test scenario for that purpose. So, if a person is trying to find a genetic counselor in their area, one resource offered through the National Society of Genetic Counselors is find a genetic counselor, all one word, nsgc.org. And that can help identify genetic counselors across all 50 states who either practice in person or through telemedicine, including a number of subspecialties, not just cancer genetics, but also areas of genetic medicine.
Awesome. Thank you.